Everybody. It's a joy to see old faces and new faces, and it's a truly an honor to have Paige Cognetti on the Zoom tonight, and also to have uh, Professor John McDonough on the Zoom tonight, with whom I've worked with for many years. Um, so I want to apologize first of all for the technical need to switch this to Zoom, and but we're going to have fun anyways, and I always have fun with what I'm doing here. So my name is Dr. Norbert Goldfield. I'm a practicing internist, and I started Ask Nurses and Doctors in 2018. And our mission is to organize local healthcare professionals in support of competitive candidates who prioritize health reform, very simply. We also work on healthcare legislation. We've worked on many different races. In this cycle, we're working on races from Maine to Texas to Montana. And so it's a joy to be working on this particular race to help elect Paige Cognetti to the House. And as part of that, what you really have a lot of fun, or what I have a lot of fun doing, is meeting local people, because the whole idea is to work with local healthcare professionals. So, for example, I know Jen Partika is on the Zoom tonight. Welcome, Jen. It's just great to have you. And there's other local people, and there's one person in particular who's going to introduce Paige Cognetti. And I've just seen her face for the first time. I've spoken with her a few days ago, and I look forward to meeting her in person. So I'd like to introduce now Susan Wiggins, and she's a medical laboratory technologist and a union vice president of the local Scranton chapter of SEIU Healthcare, Pennsylvania. It's a joy to have you, Susan, and I'm going to turn the floor over to you as you go from there to introduce Paige Cognetti. Thank you so much.
Thank you. Good evening, everyone. It's an honor for me to introduce our special guest tonight. As you may know, we were recently in a fight to keep our hospital open. We weren't sure if we were going to be sold or if the doors would be closed one day. It was hard. It was really demoralizing. But through that fight, we knew we had a friend in Mayor Paige Cognetti. When I say Paige is a friend to healthcare workers, I mean she shows up. I've had the privilege to canvass with Paige to put out yard signs to save regional. She passed a resolution honoring the frontline hospital workers at regional, my coworkers, who really work hard every day caring for our community. And she even turned the lights of City Hall purple, which is our union color. That's because Paige understands that healthcare is critical to our entire community, especially as politicians are enriching themselves with stock trades while gutting Medicaid funding. In fact, it's one of the things that compelled her to run. Congressman Bresnahan's corrupt cowardice in promising healthcare workers like me that he would never vote to cut Medicaid, only to turn around and make millions off the insider knowledge before voting for the largest healthcare cuts in American history. Taking on that kind of corruption and making sure government works for working people has been the guiding star of Paige's career and her campaign for Congress. She's no stranger to taking on big fights, starting with her independent rage against, I'm sorry, Page Against the Machine victory to become Scranton's first woman mayor. In 3 years, Page guided the city out of a 30-year distress period, brought more than 155 million in investment, and revitalized entire communities. Page has that kind of compassionate, fighting spirit we need in political leadership, now more than ever. As health activists, we're eager to hear how she will continue her advocacy and her fight to improve healthcare in Congress. I'm excited to welcome to the call Mayor Paige Cognetti.
Thank you, Susan. Hi, Jen. It's great to see everyone the car. We're very busy this evening, and so I appreciate that you guys bearing with me. It's great to address you, and Susan, what an intro. You took a lot of the story to the folks already on the call, and that's really, really important because it doesn't as I talk about what I would do in Congress, as I talk about the issues that we're seeing in Scranton, this isn't something that just started with a vote by members of Congress like Rob Bresnahan for this big awful bill, right? This is what we have been experiencing in Northeastern Pennsylvania for years now. And Professor, I was looking at your book, and the deregulation, the for-profit companies taking over healthcare over these decades is exactly what we have experienced in real time in Scranton. And that's before all of these Medicaid cuts hit our hospitals, before most of those Medicaid cuts hit the individuals that they are going to hit in very, very short order in 2027. So the story of Scranton, sadly, there's an upshot, right? There's an upshot, as Susan said. We did, keep advocating and keep pushing. We do have the hospitals still open, and that's wonderful. We're still fighting, though, to have local board membership. That's something I keep really banging the drum on and pushing for this new owner to make sure that folks like Susan and Jen, folks that know our community, are involved in the governance of these hospitals. It's really, really important that we have that. To see what we have seen in Scranton in Northeastern Pennsylvania, to know that our EMS, for example, I'm a mayor in the mayor of Scranton, we gave up EMS 30 years ago. 30 years ago, no more city EMS. It's just been private the whole time. We have an EMS crisis. We're about to propose to our city council that we start back up and make sure that we at least have a hybrid public-private option out there. I'm not sure how it's going to go. I'm not sure if my city council is going to go for it. I was told for 6 years to date, don't even try. Don't even bring it to us. We will not vote for that. This is year 7. This is the first year that I'm going to at least get a try to have a public service of ambulance service back in Scranton. So, Professor, I deeply appreciate the work that you've done to call attention to this issue, which is obviously a national issue. We could talk to you all night about how it's impacted us here in Scranton. As mayor, I hear stories, obviously running for Congress as well, hear stories from our whole district about the way that these cruel cuts have already hurt people. It includes our Meals on Wheels. They went immediately. This isn't a 2027 cut. Immediately after HR 1, they went from $6 to $4 per meal reimbursed from Medicaid. There's literally less food on the table for Scranton seniors than there was before that vote. And it's just so important that we continue to have not only food on the table, healthcare, all these things that we know are the basics to have high quality of life for people, to keep people safe, and to make sure that we have a strong economy and a strong future for ourselves, for our children, for our grandchildren. This is basic stuff, but right now we have members of Congress who are aiding and abetting an administration that is just cutting everything. They're taking a sledgehammer, a chainsaw, whichever analogy you want to use to these programs. And while our healthcare system isn't perfect, it of course needs a lot of reform, we need to make sure that we have representatives who understand what's at stake here. That is not what we have in Congress now. That is certainly not what we have with Congressman Rob Bresnahan, who truly made money off of our pain. He told folks like Susan and many other groups, Susan and as one person, but I've talked to teachers, I've talked to other folks, other elected officials, to whom this congressman said, I will not cut Medicaid. And then what did he do? He went and cut Medicaid. This is a guy who sold hundreds of thousands of dollars in Medicaid-related stocks and bonds the week before he voted for HR 1. He literally lined his pockets and gave himself a tax break right before he gutted $1 trillion of Medicaid and healthcare for very soon 25,000 of our neighbors here in Northeastern Pennsylvania. That is not representation. That is personal gain on the backs of the people you represent. That's why I'm running for Congress, and I'm grateful for the opportunity to talk with you guys about our story in Northeastern Pennsylvania and talk about how we can flip this district.
Thank you so much. And what we're going to do in the remaining minutes that we have, I've got a set of questions that I'm going to ask Paige. And then when she has to leave, John McDonough will engage in larger, broader conversation with respect to his book, and he's going to make some initial comments with respect to his new book. But let's start first with some questions, Paige. Um, First of all, could you tell us a little bit about some of your personal experiences with the healthcare system?
Me personally. Well, I have two beautiful little girls that were born right at Moses Taylor Hospital in Scranton. They are 6 and 3. So I had them one 2 weeks before I became mayor, and one during my time as mayor. So I got to experience our fantastic labor and delivery nurses and staff right there in Scranton. And it's so important that we take care of everyone. It's so important that we have quality labor and delivery. The sad part, and everyone on this call knows this, the sad part, we know labor and delivery doesn't make money. And so it is always defunded. It's on it's last on the list. What we are doing, the way that we are running American healthcare system is wrong, right? We know that that is wrong. If you can't have labor and delivery because it's not, putting the hospital in the black, we know that we have a lot of work to do. So I'm grateful that I was always able to get great care myself personally, but of course, the hospital I had my babies at is the ones, Susan's talking about, that is still open, thank goodness. But the math has to really start to pencil out better for folks in the coming years to keep having their babies at Moses Taylor.
Thank you. Do you have some additional comments in terms of, because you alluded to Rob Bresnahan's votes that he profited off of. Are there some additional insight that you could give us with respect to his tenure in Congress and even beforehand, or whichever comments that you might have with respect to Rob Bresnahan? We'd appreciate hearing about that.
Well, I think generally, like I said, Susan is somebody who he told in a meeting, I'm not going to cut Medicaid. I've talked to other people who had meetings with him that first 6 months he was a member. The governor himself has a story where Rob Bresnahan said to him, I'm not going to cut Medicaid. And he did. This is a person who has a pattern of behavior of saying one thing and doing another and thinking that the people won't notice. He thinks that he can promise, and this goes beyond healthcare, he can promise, another, like a township supervisor, a certain grant, and then he can't deliver on it. But that's not how this works, right? This is a person who doesn't understand how government works and even why government is supposed to work. We need people who are there that understand the basic functions of government and understand that government can't just say yes all the time. You cannot just say yes all the time. You can always fight. You can always make sure that what you are doing is based on your values and the capacity of your organization and the best thing for the most people. That's what I do as mayor. You cannot promise everyone everything. This is a guy, again, I'm not going to cut your Medicaid, cuts Medicaid. He pretends that he didn't. He'll actually say like, oh, but I didn't really. He talks about how he doesn't talk to his financial advisor about his stock trades. There's audio from a radio program last year where he says he talks to his financial advisor about his stock trades. He thinks that, signing off on like the ACI discharge petition is going to be enough to paper over the fact that he made money selling those stocks and bonds right before he gutted healthcare. He bought missile stocks the week that Trump went into Iran for the first time. He was gobbling up data center related stocks as he was touting just unfettered data center development in our region. And this is a person who thinks that he's just going to get away with it every single time. Our job is to make sure people know the truth and people understand that that is not what he's for. He is trying, he's been trying, he's failing to say that he's the pro-union candidate. So he'll send a letter here and there that makes it seem like he's pro-worker. And nobody's pro-worker, in my view, that is gutting healthcare from an entire community, allowing and helping to gut public education, gutting our FEMA and disaster response. These are not pro-worker people. He won't say yes to the PRO Act. He would never say yes to the PRO Act. So he'll try to, again, when I say literally paper over, he'll try to sign a letter here and there to say that he's this moderate, That is not the case at all. At the end of the day, he is somebody who is always going to vote his own pocketbook. And sadly, that is what he's shown himself to do. So we've got to beat him. We have 3.5 months to do it. We've been out raising him. We raised him 2 million to 1 million this last quarter. Our race has gone from a lean Republican to a toss up and co-political and in inside elections. We have our ads up and running on television, and we're very excited about that. We also have a campaign that's based on, a future looking vision and a set of values and a set really of principles that have joy running through them, even in these dark times. As I've been mayor for 7 years, it's such a great camaraderie with all of our community partnerships. I love that. It's very, very important to me. That's how we're running this campaign. We have an incredible team. And I'm grateful for Jen and Susan being on here to tell the stories from Scranton. It's a tight-knit community in Northeastern Pennsylvania. We have to fight for each other. We right now have somebody who is fighting for himself only, and we've got to beat him so that we can make sure that we have an opportunity to right the ship.
I just want to say that Mike Lux, who is somebody who I respect, a political strategist who I respect greatly, he sent out to a very large group of people, including Anthony Flaccavento from the Rural Urban Bridge Initiative, who's on the Zoom tonight, saying that your ads are just spectacular.
Thanks.
It definitely, it's widely distributed. I'm wondering, in your conversations with people in Northeastern Pennsylvania, among the list of what I'm going to give you, I'm wondering if you could tell me which ones are most important that people talk about. Do they talk more about affordability of health insurance, cost of prescription drugs, timely access to physicians and other healthcare professionals, addiction, care for the elderly? I mean, these are all top issues. What are the top one or two issues that you hear about mostly that we can take home from this meeting tonight?
I think you mentioned a range of them, right? Everyone has a personal touch point somewhere on that list. I think that pharmaceutical prices are always high on the list. For us in Scranton, the ER capacity has always been since I've been mayor, has been an issue. And now we're back. I was at the Treasury Department back in the first term of the Obama administration. I was not on the ACA team. I was in international affairs, but I know a lot of the folks that were working so hard on that legislation. This was how many years ago? We were so proud to be able to try to fix the problem of people using the ERs as their primary care. And here we are, we're going to go into 2027 and we're right back at it, right? It is so hard to stomach that. That's so why we have to flip Congress so that we can put the floor back under healthcare. ACA was never perfect. Nobody drafting that legislation thought it was perfect. It was always going to be a work in progress. But the way that you make positive change in a system like that is not to just rip it apart and hope that folks can survive and tread water for the 5 years before you fix it. That's not the way to do it. We have to put the floor back under. And then, it's just every single range of issues. Pharmaceuticals, again, comes up a lot. I think that we've got a lot of accountability to work on with the insurance companies, especially. To me, and this goes for not just the health insurance industry, but also just general insurance. Being a mayor and having gone through a major flooding event, I can count on two hands probably the businesses and residents who felt like they got a fair deal with their insurance company when their home or business flooded. And whenever you watch a football game, you see that it's an insurance company who was, doing that many millions of dollars of sponsorship. They are making money hand over fist at the expense of the American people. We've got to get some balance back in that.
Thank you so much. Certainly, the issues that you raised in the ER, when I admit patients, first of all, I can't admit patients anymore directly as an internist. I can't admit patients directly to the hospital. They have to go to the ER. And in the ER, at least at Bay State in Western Massachusetts, there's a 15 to 25-hour wait.
They just wait.
I was doing election work in Pennsylvania in 2024, and I had a quadriceps tendon that snapped just as I was walking. And I got myself back home, and the orthopedist said, I don't know when we'll be able to operate. So I said, well, I'll just wait for you in the ER, and 25 hours later, I was operated on, which was relatively fast. So the ER
Right.
situation is really an important issue. So kind of as we begin to wrap up, I'm wondering if you could sort of combine together, and then I'm going to just ask you for any last comments. Um, in terms of the situation facing hospitals today in Scranton, if you could comment on that, and then how has the experience of very nearly losing two hospitals in Scranton influenced your understanding of keeping our community safe? So it's really a hospital-related question as to how you see it, and how some of your experiences influence your positions today.
I mean, I'm very partial to mayors, being one now for 7 years and being very close with mayors across our region, the state, and the country. I think there are few roles that would prepare you better outside of healthcare, of course, and the doctors and nurses. Um, I think there are a few roles that would prepare you more to help join the cause and fight this battle in healthcare than mayors, because nearly every mayor I know has some story like this, right? You've got a packed ER, or you've got a community hospital that is on the brink, or even if you're a mayor of your city, you have a rural hospital that's closed, and now your ER is more jammed because the people are coming there, or the labor and delivery in the rural county is gone, so now you have a backup in maternity in your city. Every mayor has a story like this, and if you're a mayor that is close with your community, you're feeling these ups and downs with them. For me, I remember working to advocate for safe staffing levels. That's really important, and the nursing unions have been really helpful in keeping me apprised. I have a meeting coming up in the next couple of weeks about safety in the workplace. We work, of course, with the hospitals and with our police department. It's another nexus where mayors, I think, unique, pretty particularly having the police underneath them, can understand the violence that happens in these hospitals, because we get the calls, right? We get the calls when there is a nurse or a staff member, a doctor who is attacked or injured in one of these hospitals. So it's those workplace safety issues, along with the healthcare jam ups and lack of affordability, make mayors understand really well. And I'm sad that I know these stories and have done work in this space, but that's part of, I think, what I can bring to Congress. I think we need more mayors in Congress, more folks that have served at the local level who can understand how these issues, how this lack of funding really plays out on the ground.
Any last comments that you'd like to make before we let you go on to your next event?
I really appreciate you guys hopping on with us, and my local gals. Thank you, Keisha. I see you. I really appreciate you guys doing this. We have a really tough fight ahead of us in these 3.5 months. It is a tight district, and there's going to be a lot of misinformation out there, but we know that we will keep fighting. We'll have a lot of fun. We appreciate your financial support. We appreciate your on the ground support for those of you. And doctor, it sounds like you know walking around Pennsylvania well. So if folks want to come knock doors for us as well, we can always use the hand.
I was knocking on doors, and so it was an honor to do it, and I'll continue to do it. The reality is, we want you to win. We will help you win. There's no question that healthcare is a top issue. And I want to thank you so very much for joining us tonight. And we will definitely be by your side. And after the election, we will look forward to celebrating with you as you're in your victory. How about that?
And helping us craft the new policy. That's important.
Well, and that's sort of a good segue into our next speaker.
Thank you all so
Thank you
much.
so much. Thanks so
Thank
much.
you.
So, John McDonough and I have known each other for a few minutes. Um, and I want John to know that just a couple weeks ago, I did another training for the Stanford Chronic Disease Self-Management Program. I'm a master trainer in the technique. And for those of you who are interested, happy to tell you all about it. It's a wonderful technique that's been validated and used in millions of people throughout the world. Uh, John is both an academic and a politician, and has bridged both worlds in ways that I can only aspire to. So what we'd like to do, I think, is over the next 10 minutes, is John is going to summarize a new book of his that's coming out right now. I've pre-ordered it. I definitely encourage everybody, if you could put it in the chat, John, maybe a link so that people can pre-order it. And if not, if it's too much trouble, I will put it in the link. And I'll also put it in the link to when I send out a copy of the recording and put it on our website. Certainly want to encourage people to do that, to order it. And then we'll have an open conversation where people can join in either via the chat or just unmute yourselves. This is an open conversation. I just want to say that it's a wonderful joy to see some people here, and I've already highlighted some people, but I haven't spoken to Bob Crittenden in a few years, so I just want to say welcome back. It's great to see you. But there's other people who I've known, and I want to highlight colleagues from Pennsylvania, more Dunphy and Zeke Taylor, both physicians who are colleagues in arms of doing the work. So there's many people here. So I think this is going to be a great conversation. I want to also highlight Mark LePatin. Thank you for being on, another Pennsylvania physician. So you got a lay of the land, John, as to who's here. There's both line people and people who've been doing this for years. So, John, the floor is yours, and it's just an honor to have you on.
Okay, can you all hear me? Am I
Yep,
coming through? Excellent.
perfect.
Okay. It's an honor and a pleasure to be here with all of you. Norb, my memory is we've been working with each other for about 45 years now. So it's been a long time and great to see my pal Bob Crittenden in the room and Jan Singer, just some wonderful people who've been so committed for so long. So I was a state representative in Massachusetts for 13 years, chaired our healthcare committee, and did a lot of work. Sometimes I call myself a politician in recovery. It's a lifelong affliction that's hard to get out of your system, and I ain't even trying anymore because the issues are so important. I have been since 2011 a professor of practice at the Harvard Chan School of Public Health in Boston, where I do lots of work on US and state health policy and even healthcare issues outside of the US these days. There's so much going on. And I decided about 6 years ago, back in 2020, that someone had to write a book that presented the background, the full picture of how US healthcare got so distorted. We all know the issues. We hear about them all the time. There's the impact of monopoly, corporate concentration, oligopoly that has been creating these massive behemoths that are really directing our healthcare system, United Healthcare, CVS, so many others. We have this phenomenon known as private equity, which is a financing force that has been buying up healthcare and turning it over like house flippers as a way to make maximum quick financial returns for the key investors. We see privatization across the healthcare system. We hold ourselves high for the Medicare program and the Medicaid program as commitments to providing healthcare, particularly for those in the most critical need. And yet at the same time, we see both of those programs right now, a majority of people in them actually are in private health insurance systems and not in what most people think of as regular Medicare or Medicaid. We see an incredible backlash against efforts to try to address the deep and systemic inequities and inequalities in the healthcare space. We have an epidemic of cost sharing at high levels that are preventing people from approaching and getting the medical care they need. Connected with that, we have this incredible problem of medical debt, more than 220 billion across the United States of folks whose financial lives and lives are being ruined because of medical debt that just no one in their right mind, except for very wealthy people who don't need to get rid of it, can address. We've seen a major offensive against labor unions all over the nation and very much in the healthcare space. And we see constant efforts to try and shrink government and make government less and less capable. Those are some of the primary symptoms of a healthcare disease. And I think a lot of people hear about these things and think about them discreetly. Well, there's this problem here, there's that problem over there, and they're not necessarily connected with each other. And so, one of the things I've attempted to do with my new book, that the publication date is August 11th, so it's not out yet. You can pre-order it if you want, but is to tie all these phenomena together because, in fact, they do emanate from a single source. It's not a conspiracy. It's not a plot. It's not a secret thing that's going on, but it was a national phenomenon that is not generally understood. And the term of art for it is something called neoliberalism. It is a political economic movement that emerged in the 1940s and grew and developed. And when Ronald Reagan became president, this became the major governing philosophy for the United States and very quickly drew into it. It drew into the phenomenon the health and medical care systems in the United States. And it has had a dangerous and bad impact across American society. And there's a saying that if you don't know where we came from, it's a lot harder to figure out where to go. And so I decided that it was important. I started this back in 2020. I thought it'd be done in about 2 to 3 years. It took me over 5 years to do it. And it's coming out. And it's coming out at a time, I mean, I wouldn't have known it back in 2020. I would have hoped back in 2020, by the time we get to 2026, we would have fixed most of these problems. And instead, we see them getting worse. And of course, there is the issue from the Trump administration where we are going to see over the next several years, at least 10 million people are going to lose their health insurance coverage. Either they're going to lose Medicaid or they're going to lose their ACA subsidized coverage, which has been their only option. So there are ways to try to understand what's been happening here. And I believe, because I put so much time into it, that this is a story that needs to be told and needs to be understood. So I put the address of Johns Hopkins Press. They're the publisher for it. Also, there's a 4-letter code, HTWN. If you use that, you get 30% off the price. If it's okay, I'll hold up the book so people can see what the cover looks like. I don't know whether that's backwards or not. But that's it. And it's an academic press, so it's not one of those mass publication, trade publications, they call it. But what I've been finding is that people are hungry for understanding and answers for how it is that we could have got in this space. And there is an answer, there is a story. It is compelling, and I believe it's really important. And so I'll stop there in keeping with my 10 minutes, and I'll be around for as long as we're on here this evening. And thanks for the opportunity thanks for the opportunity to meet Paige Cognetti. I mean, she is terrific. She's going to be a wonderful member of Congress, and I really wish her the best and do everything we can to help her. And so many other Paige Cognettis who are running all over the United States right now as well. This is an extraordinary year politically in terms of opportunities. So why don't I stop there, because I'm hoping we can have some conversation and discussion.
Well, great. And I will say, I'll echo your last point, last 2 points, which is to say that number one, for those of you who are at all interested, please financially support Paige. I'll definitely be making my contribution. I want to encourage people to consider it also. And I want to say also, John, I'm very impressed with some of the candidates that we're meeting and supporting. There's a guy out in Montana whose name is Sam Forstag, who's a firefighter, and he's just amazing. He's just, these are great people. There's a person in NY21, Blake Gendabine. I mean, so at any rate, that's what the wonderful thing about starting Ask Nurses and Doctors 8 years ago. You really meet people who are really they're putting their time, and they're really putting themselves at some risk, as we all know today. So I'm gonna take the liberty. Please put some comments or questions rather in the chat and or just raise your hand. But I'm gonna take the liberty of asking two very different questions. I'm of course very excited to read the book. I've read some of the references to it in the Milbank Quarterly. So I assume some of that, some echoes that are in your book are coming out in some of the articles. And I'm wondering, you and I have discussed this over the last 4 decades. It seems to me that we're coming to a political point now where at least the idea of public option, either at the state or it's not going to happen at a national level, but a public option, is realistic politically. And I'm wondering what's your sense of that as an opening question in terms of what's your sense of considering the crisis that I increasingly see going on?
So I think that it's entirely possible that we will be in a situation next year where a public option is something that could become a viable conversation, uh, particularly if we have Democratic control of the House and the Senate. Then that gives them control of the congressional agenda and the ability to push it forward. They will be able to, if they have both chambers, frame a reconciliation bill. And it is possible to create a public option through a reconciliation bill where instead of needing 60 votes in the Senate, you can do it with 51. Now, then you've got the issue of President Trump giving a veto to it, but that's that then is the higher level of the drama. But it's definitely possible to take the issue, frame it for the public, and sell it, and tee it up and get it ready then for 2029, hoping that in 2029 we will have a Democratic trifecta where we control the House, the Senate, and the White House. And yeah, then I think it's entirely plausible that that could happen. I doubt, who knows? I doubt we're going to see a Senate that has at least 60 Democrats. And it's very hard to conceive of any Republicans who would vote to create a public option because it would just be such a political conflict over it. But it is conceivable to me that there is a pathway to get it done. The other thing, of course, is it is possible. I wouldn't bet money on it. It is possible that Democrats will take the House and the Senate, and one of the things they'll do is get rid of the filibuster. That is a possibility. I wouldn't bet the house on it for sure, but it's not out of question as well. So I see a number of pathways that say that yeah, that could actually become real over the next 4 years or so.
So now I'm going to ask completely on the other side, and then we'll open it up, and then we'll just look to the chat. There's already a good question in the chat, and hopefully encourage others to join in. And Anthony is right after Jen. So in 1993, I remember we were talking about this. I started an organization called Hampshire Health Access, which was essentially a way to provide free medical care after Clinton health reform failed. And so then it became largely unnecessary, when Obamacare came about. And now we're, of course, reversing. I'm not sure if you know this, but at Bay State Medical Center, if you don't have health insurance at our practice, you can't be seen anymore, period. So I'm starting a free clinic, and we are testing it out. We're doing a test run in August. We got a 501(c)(3). We're operating out of a church, and we're actually starting to see patients in September in Springfield. What's amazing is that there's like 5 or 6 of these places around Massachusetts. So I guess the question I have, it didn't even cross my mind that we're back at this point again. But we are. People are really needing care. So I'm just wondering as to, yes, you talked about it right now. So it's several years before we can get significant health reform. I know it sounds maybe just silly, and I feel almost embarrassed to ask, but where does free clinics come into play, and how do we politically kind of make them maybe more visible? And then I'll pass it on to Jen. If you want, I can read your question, Jen, or if you'd like to read it yourself, you can. John, with respect to free clinics?
I think free clinics are, federally qualified and non-federally qualified community health centers are there to take on all comers.
Yeah, but
Um,
they're, everywhere in Worcester, sorry to interrupt you. In Worcester, the community health centers have a 2-year wait list. In
mhm.
Springfield, it's a 1-year wait list.
Yep, right. Understood. Right. So that situation varies a lot and is increasingly troubling, and they are under incredible financial pressures from the federal government as well, through the Medicaid program. So I think that depending upon what happens in November, particularly if we've got House and Senate, there is a possibility to put pressure through Congress on the administration to build in some restorations, to build in eliminating this work requirements thing from the Medicaid program, which is already having a disastrous impact across the country. Already in states like Nebraska, they've started it early. So I think that we will see opportunities. It's not going to be a slam dunk like it is when we controlled the White House and Congress. But this is setting the stage. I think also that the Trump folks in 2017 tried to do a frontal assault and repeal the entire ACA, and they failed. And the American public wouldn't stand for it and wouldn't let them do it. And that's why John McCain gave the famous thumbs down. But in this situation, they aren't doing it with a frontal assault. They're doing it off to the side here and there through changes to Medicaid that most people don't understand what it will do. With the non-renewal of the enhanced subsidies in the ACA has created a devastating problem for working folks and middle income folks. But I think that there are avenues. This is such a high priority for Democrats that it's hard to see we're going to get in there and there's not going to be something that's done, and it will be part of a negotiation with the Trump administration, as difficult as that will be. And then if they won't do anything, then I think that then becomes a further political weight in terms of not electing a Republican president in 2028.
Jen,
Um,
the next
in
question.
terms of Jen's question, if I can just
Yes, I was just going to
address
read.
that great question, Jen.
It
So
was,
I think COVID had lingering effects. However, I think that to some extent, for a lot of people, that's in the rearview mirror, and the questions that they're facing in in Scranton right now with keeping their hospitals alive, uh, that's not COVID. That's today. That's the failures of the system and the politics today. That kind of thing is allowed to happen, and that there's no place to stop it. Gallup came out with their annual survey just last week, about trust in various American institutions. And one of the things they always ask about is, do you trust the medical care system a great amount or quite a lot? And when you go back to 1975, because they've been doing it that long, in 1975, about 77% of Americans said that they mostly trusted the medical care system. In their recent survey that came out last week, it is down to 28% of Americans say they trust a whole or a lot their medical care system. Now, it's going down for loads of institutions, but in terms of medical care, it has never been lower. So I would say that what's going on right now is more than and beyond what we're dealing with COVID at this point.
Anthony, it's great to have you on. The
Uh,
floor is yours.
Glad to be here, Norbert. Thank you. John, I look forward to reading your book. I'm in a little town in the Appalachian part of Virginia. My organization works a lot on fighting the impacts of 45 years of neoliberalism. I have two kind of related questions. Does your book and does your perspective deal with the need for a tremendously reinvigorated antitrust? That's one, because it seems to me that's central to why neoliberalism has become so devastating. And then kind of the flip, well, it's not the flip, but just a related question is in areas, lots of rural areas, small towns, people have gotten really creative about delivering healthcare. And I had a dear friend for many years who was a Catholic nun, died recently, but she started the region's first mobile health clinic out of an RV. And I know they're more common now, but when she started it in the coal fields of Appalachia, it was quite a novel thing. Is there a way to design a Medicare for all system that supports and invests in kind of local initiatives like that? Because rural people, small town folks tend to want to solve our own problems. And if the solutions are all boilerplate, top down, cookie cutter, it's going to be harder to sell and harder to deliver than allowing for investment in things like mobile health clinics or other things like that.
Yeah, great questions, Anthony. Let me take the first one on top and just say, yeah, you can put together legislation through Congress that provides hundreds of millions or billions to support those kinds of free clinics and those kinds of special ways to get at people. It's entirely doable. And as you say, it doesn't need to be reinventing the wheel because we're already familiar with how to do it. And so I think there is it. In terms of monopoly and antitrust, so an entire chapter of my book, chapter 6, is just about antitrust, monopoly, oligopoly in the healthcare space, and importantly, how we got here. How we got here that, basic about 90% of hospital markets in the US, about 75% of insurance markets, and about 60% of physician markets across the United States, county by county, are considered heavily concentrated using the standard measures of corporate concentration in the healthcare space. How did we get here? There's probably no example where the fingerprints of neoliberalism are so glaringly right there on the mechanism. It was a lot of us probably have heard of a guy named Robert Bork, who tried to get on the Supreme Court and never got there. Before he did that, he, from Milton Friedman's University of Chicago economics department, he was pushing a line that said that antitrust in the United States was all wrong, that it's not that big is a problem and that we have to control bigness. It was, listen, as long as consumers see lower money from any particular transaction, they should get a green light and be able to do whatever they want and let the free market take care of it. And that idea, which he wrote in a book that came out in 1976 called The Antitrust Paradox, he laid it all out. When the Reagan administration came in, they rewrote the federal antitrust guidelines, which is the direction to federal prosecutors, to judges, to everybody in terms of what we think about this. Their guidelines that they put in place in 1981 embodied and put into place Robert Bork's prescription for antitrust called the consumer welfare theory. So yeah, it's there, and that's why I think it's important to understand this story. It didn't just kind of happen by random. There were informed, intelligent, smart actors who understood what they were doing and methodically worked over years to move this country in a very harmful direction.
Thank you. Bob Crittenden, it's just a pleasure to see you. It's been a minute. So you
Great.
got the floor to ask this question.
Great to see all of you. It's wonderful. John, sounds like your book is going to be very interesting. I have a question for you. One question to Anthony. Well, not a question, but a comment that I did a lot of rural stuff a while ago, 20 years ago or so. But I found that there's a lot of bipartisan support for rural activities. And, if you think creatively, there are ways to develop, as John said, different kinds of funds or supports. And at that time, we were talking about setting up a kind of a fund that would help small communities on a rotating basis provide both technical advice as well as capital so they could have even an insured sort of product or something for their communities. Now, that never happened for a lot of different reasons, but just there are a lot of things you can do from the rural perspective. But John, what I want to talk to you about is, to get some, the things we're worried about right now. I mean, there are huge things going on. You're kind of the neoliberalism, the direction we've gone with all the consolidation is huge. I mean, and I don't know what the book says, but I would love to have a strategy about how we approach this. And I'm thinking right now very immediately that the only thing I can find some bipartisan support for right now is cost containment, whatever way you want to call it. And I wonder if you've thought about that or how that fits in, because I know Community Catalyst is working on that, Families is working on that. In our state, we have a lot of activity. All of us are running into log jams because of the industry. But I'm wondering strategically if you thought about how that fits into your activities. And I'd love to hear from you.
Yeah, lots of ideas. Just a couple of things. One is, we've given the free market in terms of controlling healthcare costs a run and given it a chance to show what it can do, and we see the results. And so when you have market failure, which is what we have in healthcare, then you need to have government come in and set different rules. And maybe that means government going in for a period of time and setting prices, however that happens. But government needs to move in and act aggressively. And we're seeing states try to move in that direction. Obviously, we don't talk as much about affordability issues in Medicare because back in 1983, Congress, facing a failure of the market in Medicare, created national payment regulation. And Norbert actually, most people don't know it, Norbert was one of the people who actually helped to design and implement and manage that system, the prospective payment system, the DRG system that's gone through many iterations, but it's still there and nobody talks about getting rid of that. And it's not a communist plot or anything like that. That's just how that railroad runs. So yeah, we can do that. But the
Implemented by
other
Ronald
thing,
Reagan. Signed by
yes,
Ronald Reagan. Let's not forget.
absolutely. But that's why this history, there's a quote I use from Harry Truman. He says, "Listen, the only thing you don't know is the history you haven't read." And I just think it's true. But there's another saying. This is the last thing I'll just say here. Is that is a antitrust expert who knows this field very, very well, has a quote. He's saying that the U.S. healthcare affordability problem starts with healthcare monopoly. It is, and many esteemed younger, talented economists are saying, listen, you got to understand that when you talk about affordability, it is the mind-boggling corporate consolidation that made this happen.
Well, as those of you who know me, I try to start on time. We were a little late because of technical issues, but I always try to end on time. It's 8:31. I want to just say three concluding comments. It's a joy to see all of these wonderful faces. Thank you, John, so much. Please consider buying his book and commenting on his book. It's definitely, I'm really excited about it. Consider supporting Paige Cognetti's campaign. It's great to have you all. Thanks for everything. And I would encourage all of you on July 29th, we're hosting Gina Hinojosa, who's the gubernatorial candidate in Texas, and she'll be speaking alongside with Don Berwick because Gina's principal campaign pitch is going to be as to what can be possibly done politically in Texas is focusing on kids. And for those of you who don't know, Don is a pediatrician. And I hope to see you all there. Thank you very much. Good night, everybody, and appreciate your being here with us. Bye-bye now.
Take care. Thanks, Norbert. Thanks, Bob. Thanks, Jan.
Thanks to everybody. Bye-bye now.